Hello everyone. So this is a month of gastrointestinal cancers, and I thought we will make some videos and write some articles etc. for patient awareness about gastrointestinal cancers. So one of the most common types of gastrointestinal cancers that we encounter today are colorectal cancers. And the main presenting symptom in this type of cancers is irregular bowel habits. So patient may have either long standing constipation or long standing diarrhea. Any of these two symptoms may be there, and if patients try to address these symptoms in the initial stage itself, they will prevent themselves from developing colorectal cancers. Now, how to address these symptoms? So, as I always say, if we want to address a symptom, we have to look at the cause behind that symptom. So, there can be variety of causes. The most simplest of causes is diet, where if the patient is having lots of red meat, patient has less fiber in their diet, uh, patient drinks too much of alcohol, smoking, tobacco chewing. These are the most common, sort of, we call them the external factors, like which you can control, which is in your control, which if you yourself want to take health into your hands, you can improve your diet. Instead of eating red meat, eat white meat like fish. Hmm? That is better. Increase the amount of fibers, increase the amount of green leafy vegetables, salads, carrots, beetroots. These are very good for this type of cancers and their prevention, and even if someone has developed this kind of cancer. Then the next type of causes is diseases. Patients may have the particular kind of disease which is predisposing them to this constipation or diarrhea. So it can be irritable bowel disease, it can be inflammatory bowel disease, it can be simple polyps that are found in the intestine, which initially are sort of asymptomatic, or which cause minor symptoms, and which patient does not sort of look or try to address them, and which can later on transform themselves into cancer. So this is very important. Instead, generally what is happening is, instead of trying to address the pathology and the reasons behind this pathology, whether it is inflammatory bowel syndrome, irritable bowel syndrome, or polyps, we are taking treatments which are only going to stop the symptoms of irritable bowel syndrome. So just stop my diarrhea, just stop my constipation. This will allow the disease to slowly and steadily increase in your body. Instead, if you take the homeopathic approach, where we try and understand the reason behind these diseases, like most common reason for irritable bowel syndrome is mind. The mind is not functioning properly. It's more hyperactive, lots of anxiety, lots of irritation, lots of fears, lots of tension, lots of worry. This is the kind of personality which will develop such diseases, and which we, if we don't address with the right homeopathic remedy, which it can transform itself into more deeper pathologies like cancer. See, homeopathy has immense potential in transforming your mindset, in your viewpoint towards life. It will give you the right viewpoint, it will make you see things in a more positive way. Everybody says that we have to look at the half full glass and not the half empty. How to do that is the big question that all of us have, and that's where homeopathy comes in. It really has the potential to make you see what you should see, make you think make you feel what you should feel rather than what you are feeling. What should you feel? What should you think? What should you do? That's what the potential of homeopathic remedy is. And once that inherent mechanism is stimulated, you inherently want to eat healthy, you inherently want to think positive, you inherently know how to ignore things, you inherently know how much importance to give to certain things and what things to leave in life. So that's what you will get with the right homeopathic remedy. And the last type of causes are genetic causes, genetic factors which predispose, that there is a strong family history, there is a strong disposition in the genetic predisposition in the patient, which we in homeopathy have special remedies known as the anti-miasmatic remedies. And if you take those remedies, your genetic predisposition will be taken care of. That's what we offer in homeopathic treatment, and that's what is the most holistic and the most deepest way of preventing cancer and also treating cancer. If you have cancer, if you have already developed, then these remedies will help improve your bowel, help improve your mindset, help improve your appetite, help improve your sleep. So your symptomatic load will reduce, your sleep will improve, your appetite will improve. Even if you want to take the homeopathy along with your allopathic treatments, you can choose that. That will also help you reduce the side effects of chemotherapy, surgery, radiation, and things like that. So that is what you can do as patients to prevent or treat colorectal cancers. Yeah, I hope I have been able to answer and tell you the homeopathic point of view. But if you have any other doubts, if you want me to talk specifically about anything or write specifically about anything, talk about any remedies you want me to differentiate, etc., but please don't ask me what is the remedy for this condition, because there are no remedies for a condition. Like I am telling you repeatedly, there are remedies for the causes of that condition and not the condition per se. You have to look why you developed this pathology, and that why needs to be addressed and not the pathology. There is no remedy like give a remedy for irritable bowel syndrome. It does not work like that. It's not the right potential of homeopathy. It may give temporary relief to you for a few days, but actual transformation and actual potential of the homeopathic remedy will be seen only when you try to address the cause. So if you want me to talk about certain remedies, differentiate remedies, I am more than happy to do. Please ask whatever questions you are. I am eagerly waiting for those questions and would like to answer them as soon as possible. So see you soon. Till then, bye bye.